Hello, everybody, and welcome to this side event of the escaide conference on collecting NPIs in response to a large-scale pandemic. Great that you made it, and I think it's a very important topic, as everybody who was involved in pandemic preparedness, I think none of us imagined that NPIs will ever have such a great scale in a future response. It is also an unusual time still to do all of this in a virtual mode. Still, it's great, I think, that we have this opportunity to meet also in these times. And I hope it will be as interactive as possible. So you're always welcome to use the chat if you have questions or comments. The chat will also stay open after the side event, so you can still put your comments, and so they will be kept. Yes, and I particularly want to welcome our panelists for today. I will first introduce our panelists, and later on then we will have time for some questions. So I would first like to ask Alessandro from JRC to introduce yourself.
Thank you, Thomas. My name is Alessandro Annunziato. I am part of the Joint Research Center of the European Commission. The Joint Research Center is the scientific body of the European Commission, and we support them in identifying priorities and providing replies to questions that they have. For the case of pandemic, we acted as supported with a number of activities, one of which is the response measure database that will be more introduced by my colleague Tommi.
Thank you very much. And I give the floor to Claudia, if you could briefly introduce yourself and the database.
Hello, I'm Claudia Manili. I work for ACAPS, which is an NGO that provides analysis in the humanitarian sector, so quite different from a pandemic health related. But really in relation to the pandemic, what we did is we started to collect data about containment measures taken by the governments, starting more or less from mid-March 2020. And trying to have a database that was covering globally. So we tried to track these measures on a global scale, first going on whatever was taken on a national scale, and then going more on a granular base, trying to track a subnational level. As a general taxonomy, we did use like mainly 5 categories, and we had, of course, 35 different types of measures. But as our taxonomy involved the 5 major categories, such as social distancing, lockdowns, movement restrictions, public health, and socioeconomic measures. And of course, we were involved in the collaboration with our international agencies, such as the WHO, providing information with our data set to them. And unfortunately, our dataset stopped on December 2020, but I will explain later why this was a challenge for us. Thank you.
Thanks a lot, Claudia. So the next I have here, Helen. Could you please introduce yourself?
Yeah, sure. So my name's Helen Tatlow. I'm the Data Systems Manager for the Oxford COVID-19 Government Response Tracker at the Blavatnik School of Government at the University of Oxford. It's quite a long name. And we publish a global panel database of pandemic policies. So this kind of came together in March 2020, where the team decided that they couldn't find the data they wanted on what different governments around the world were doing to respond to the pandemic in terms of NPIs. So we created a systematic, cross-national, cross-temporal and comparable measure of government response. We've got 20 different indicators now, so they cover things like school closures, business closures, stay-at-home orders, economic support measures, and we're recently kind of collecting information on vaccination policies. around the world. We've got data on 185 countries, regions and territories, and we're also collecting subnational data for the US, Brazil, UK, Canada, China, and currently building Australia, Italy and India. And it's all published on GitHub in real time and is available for anyone to download. And yeah, it's been a really big effort because we kind of rely on an international pool of volunteers who we train ourselves to help us collect that data. Thanks.
Great, thanks a lot. So the next one, I would like to ask Chris, if you could introduce yourself and the database.
So my name is Chris Grundy. I'm at the London School of Hygiene and Tropical Medicine, and I am the PI on the global public health and social measures data set, which we put together with WHO. We've come at it from a very different background to everyone else in that we take a collaborative approach and we take other people's data sets and put them into one data set. So already, we take the Oxford data, or we take ACAPS data, or we take the European Union data, and we put it all together into one framework. We started looking at this in February 2020, and we started putting all the data together in March, and have continued since then. We cover 234 countries, areas or territories, and we have national and subnational data. Obviously, as Helen's mentioned, we incorporate their data, so anything they have, we have. Our taxonomy is slightly different to a lot of people's, I think, in that we spent a lot of time working with WHO and public health experts to look at what interventions would be put into place. And then, so we haven't had to modify ours. I think we're probably the only group that haven't had to modify the taxonomy and bring in new measures as we went along. And we've got 8 major categories, which are subdivided into individual measures, covering individual, environment, movement, international travel, prevention, treatment and vaccinations. And then we've also added some categories to allow people to look at other data. So because we have data across 5 or 6 different groups, it allows you to compare how different groups are collecting their information. So we have coding around this is a duplicate from a record we already have. We have a record to say this never happened. A lot of policies were put out and then were changed, so we have a record for that and things like that. Yeah, our data's publicly available. We make it available through WHO's website. Thank you. So.
Thanks a lot, Chris. So the next would be Tanya. Could you please introduce yourself and the database you're working with?
Yes, thank you, Thomas. My name is Tanya Schmidt. I'm based in the Health Emergencies Program at the WHO Regional Office for Europe. And as part of the COVID response work, I'm leading the monitoring and data collection of public health and social measures. A lot has been said already by Chris, but just maybe in summary, we've really started collecting this data already in January 2020. We have an obligation under the international health regulations to provide information to member states on international travel measures that may interfere with any additional health measures that may interfere with international travel. So we've been receiving information from countries and reporting that back. We've then expanded it, and as Chris mentioned, we have developed the WHO PHSM taxonomy, which has these 43 subcategories, and that was really quite a big work in the beginning of the pandemic. And then based on that taxonomy, we have been building our regional database covering all 53 member states in the European region. And as Chris mentioned, this has then is also being expanded globally to be featured on the WHO PHSM dashboard. We are, yes, collecting the data at a national and subnational level. We also incorporate information that we receive from our WHO country offices, from member states directly reported to us, and then, of course, through our own monitoring work. The database is used for our work a lot in terms of course, providing situation analysis, trend analysis across the region, but also using this data set for effectiveness studies and policy support to member states in terms of decision-making calibration on PHSM. And as others mentioned, yes, quite a lot of difficulties in managing this large data set, displaying the information. Measures have changed a lot over time, so constantly adapting to that, keeping the taxonomy flexible. And of course, it is very labor intensive, as mentioned by others as well. But over from my side, very nice to be here.
Thanks a lot, Tanja. So, and the last on the panel would be Tommi. Could you please introduce yourself and the database?
Thank you, Thomas. Yes, I'm Tommi Karki. I work in the European Centre for Disease Prevention and Control as a surveillance expert, and since early 2020 in COVID-19 related tasks, including the data collections on non-pharmaceutical interventions. The ECDC and JRC Joint Response Measure Database started, at least on the ECDC side, in around mid-March 2020. And similarly as the other databases already presented here, it collects structured data on non-pharmaceutical interventions with the type of the implementation and level of enforcement, and is organized into a hierarchical structure with 3 levels to specify these interventions. The first level represents 7 different categories of interventions, which include, for example, case management and quarantine measures, hygiene and safety measures, and physical distancing measures. And these NPIs can then be further categorized by 2 additional levels by increasing specificity and providing more detailed descriptions. For the area, we mainly collect data for EU, EEA countries, and the primary level has been national level. However, we have also recorded regional and local information, especially for certain countries. And as the name of the database implies, our database is a collaboration between ECDC and JRC since April-May 2020. Like for strengths and weaknesses of our database, maybe the biggest strength has been from 2020 and until late 21 that our data collectors at ECDC came from various EU EEA countries with national language skills and knowledge of the country and administrative structures. And also in the early months of the pandemic, we went through a very rapid turnaround of improvements that made the database stable for a relatively long period of time and helped to set the structure and taxonomy. And also the web app developed by JRC in summer 2020 made the process smooth for the users to perform their periodic updates. For weaknesses, similarly as has been already mentioned a little bit, we have somewhat limited and varied collection of data on regional and local measures where there's more detail in some countries than others. And these issues have been increasing since late 2020. And additionally, and related to the subnational implementation of the measures, whilst we have this quite rich taxonomy as well, a lot of nuances of the measures and how they are actually implemented are still lost in this structured data and possibly only available in free text fields, if at all. And the ECDC-JRC Response Measure Database collection will continue into 2022, and the exact time when we will conclude with it is not known yet. And similarly, as already mentioned, also the data from our database is publicly available for anyone to use. Over.
Thanks a lot, Tommi. And at last, I also want to introduce myself. My name is Thomas Hoffman. I'm the head of section for emergency preparedness and response, also at the European Centre for Disease Prevention and Control, ECDC in Stockholm. Okay, so again, warm welcome, and I'm really looking forward. Thanks a lot for the panelists to getting ready to come to this event. And we definitely want to learn more. I will now, just see if we can get some more information. I mean, you have started already touching upon many issues which probably are of interest in this side event and discussing about NPIs and collecting NPIs. But there's a very fundamental question maybe in the beginning, which I think none of you right now touched upon. I mean, it's maybe also almost a philosophical question. Why did you start a database? And I don't know. I'm starting with Claudia. Could you please, do you have something to contribute? Why at all?
So as ACAPS, so as humanitarian NGO, of course, something like a pandemic starts. And of course, we were in discussions with other agencies saying, okay, what can we do? It's not really humanitarian, but it's actually kind of sudden onset. And so we decided, okay, let's see what can we do, where the info gap is. The info gap at that time was still like, government measures. Like some agencies were starting to collect data, but it was all very confused. If you remember those times, in the very, very beginning of March. So we decided, okay, we cannot go health-wise because we are humanitarian NGO. So we decided to go with these government measures. We started, of course, in coordination with the other humanitarian agencies. And we also thought, okay, we are humanitarian, yes. And as ACAPS, we rely most likely on secondary data review in sudden onset disasters, which placed us in a very, let's say, privileged place to be able to act in a fast way to collect data on specific unknown situations. So that's the reason why we decided to start in the first place. If this answers your question.
Yes, no, thanks a lot. That's very interesting. Maybe moving now to a international organization. Tommi, any thoughts on this? Why did you or why did ECDC start a database?
Well, yes, like ECDC and the JRC database was, on the ECDC side at least, started to collect the information on non-pharmaceutical interventions quite early in 2020. And how it actually started was that the first data collection was done by extracting a list of response measures that were reported by EU member states in the confidential early warning and response system, and then doing a public website check to see which of these information were actually publicly available. As many of the measures were aimed to guide public behavior, these data are actually intrinsically publicly communicated and available. And at that point, we also then collected public data for additional measure categories, which were not included in the early warning and response system data that was reported by the member states. And we followed at that point the ECDC guidance on physical distancing, which was issued at the time. And there, at that point, we then set up structured files and structured data to collect the data and filled it in from retrospectively for the January-March 2020. So we did it around mid-March and March at that point. And then soon continued collaborations with JRC, where they then provided considerable technical support on how to do the updates. And of course, the kind of motivation on why did we start this was because at that point there was an urgent need to be aware what was being done on member state level, to be able to describe the state of the pandemic in early 2020 and to support the modeling efforts at ECDC to issue projections on the pandemic trajectory, both in the EUEA and in the member states individually. And also then eventually to be able to assess the effect of the measures when some time would have passed, which was to a certain extent possible already in the spring-summer 2020. And also at the same time in the spring 2020, ECDC had other COVID-19 surveillance and epidemic intelligence activities, obviously, including, for example, automated web scraping to collect data on hospitalizations and ICU admissions, which then subsequently allowed us to do further description of the pandemic and preparing model projections and such analysis. Thank you.
Thanks a lot, Tommi. Yes, so I think it really seems it was quite obvious to start something like this. Claudia, coming back to you, why? I mean, you mentioned it was not so easy. I think you mentioned in the beginning. Could you elaborate more on challenges you were facing?
Yeah, starting with something that it was pretty much unpredictable and changing very fast. One of the biggest challenges that we encountered, and probably some of you mentioned it already, is the real need for a flexible taxonomy. So when you structure a data set, okay, which categories you put inside? So we started like, okay, let's map what we encounter. Let's see little by little if they fit together. And then if something new comes up, you should be flexible enough and build a structure flexible enough to be able to have this new measure coming in. So on one side, there was like let's say the analytical way of seeing this, but also there was also a data way of seeing this, meaning that the actual structure of how you structure your data set should have been flexible enough to be changed upon new measures. One other big thing that was a big challenge for us mapping introduction of measures was very easy at the beginning, but what about phasing out? The phasing out of measures, many governments, they might have enacted many measures as a package, but phasing out is quite different. Are they phasing it out in a gradual way, in a very hard way? So that was really, really a challenge for us to track everything. And then personally, as a specificity of ACAPS, for us being a humanitarian NGO, that was not specifically our mandate. So after a while, if no one gives secure fundings for this type of projects, of course, someone like ACAPS, so a non-profit organization in a specific sector that was not related to COVID-19 specifically, we needed to abandon the data sets at a certain point. And that's probably a specificity of the NGO sector in this case. But yeah, that was a major challenge because also the fading out of this was kind of not easy to handle, especially for our users. Thank you.
Thanks a lot, Claudia. I mean, that really seems to be a challenge, not to having the finances anymore. I saw Helen nodding when you were talking about challenges and maybe less of financial challenges, but maybe some others you understood from Claudia. You had the same maybe.
Yeah, definitely nodding because we experienced similar challenges in regarding the need to be flexible because what we knew in March 2020 when we kind of created the database is very different to what we know now, and the world looks very different. The policy world looks very different. One of the key challenges we've also faced is adapting to change and trying to make sure that we're kind of capturing information that's relevant and that the world needs. We started out with 7 indicators. Then within the first month, we expanded to 11. Since then, we've had a total of 23, and then we retired 3 and introduced 3 more. So we're kind of always changing and adding. We've now got vaccine policy indicators, which we're hoping to release soon, and kind of coming up with the kind of specification for a new indicator. And then not only kind of designing it, but also implementing it requires a lot of resources. Kind of the more that time goes on, the more data points that need filled, and potentially recoding needs to be done. So we're kind of always on our toes thinking, oh, what do we need to introduce? What might need changing and adapting? And that kind of links to another challenge that we experience, which is managing our pool of trained data collectors, who are kind of the only reason that our project works. This amazing pool of a lot of students and people who are really interested around the world, who we train to help us collect the data for the database, and making sure that they're trained, they understand the new changes, that we're responding to their questions, that we're recruiting new ones as people leave, and so on, is kind of a very separate challenge to the more technical side of the coding and the database itself, but equally important. So yeah, lots of challenges, but really exciting project to be part of.
Yes, there seem to be many challenges, and I mean, as I mentioned in the beginning, I think probably none of us really was prepared. I mean, no national preparedness plan ever included something like a response measure database. So in that sense, I think it's not surprising that there are many challenges. Maybe turning now to Chris, it seems to be quite complex, the type of data you're collecting and the coordination you are envisioning. I mean, what are the issues you're facing, or how much were you ready in a way for this undertaking?
I think, we've already heard from Claudia, Tommy, Helen, but I think globally we were just unprepared to collect information on interventions. It's something we've ignored as a data collection, despite the fact that in several groups have been campaigning that we record information around interventions. And this has it just put in place a lot of the fact that we weren't ready, we didn't know what we wanted. So, it's highlighted by the taxonomy. Normally, you know, we would have a taxonomy in place, and I think people were trying, you know, every individual group has been evolving as they went along, but I think careful planning around that shows, you know, with the WHO taxonomy, which is based, we knew what interventions were going to be put in place because they've been put in place for SARS outbreaks and for Ebola outbreaks in Africa. We just never recorded them. And I think having that taxonomy available and having groups, you know, groups have sort of evolved more to be, their taxonomies have sort of come together a bit. Having that out there at the start and groups understanding that this was done by experts probably would have saved a lot of time. As Helen and Claudia and Tommi mentioned, we didn't know what information about, you know, once you've defined your taxonomy, what information do you collect about that measure? Do we want the policy or do we want its implementation? I mean, those are two very different things. You know, New Zealand has a very stable policy, which hasn't really had to be implemented. They show up quite low on the stringency indicators, but actually their policies are all there, and the reason they show up low is they haven't had to implement a lot of their policies. So, you know, how do we cope with this implementation? How much detail do we want? Does it really matter if haberdasheries close? Does it matter if Olympic athletes can't train? You know, those are some of the records that are showing up on our database because those are the ones that tend to make the news. But actually, does that matter from an analysis perspective? Do we care that Olympic athletes can't train? Is that going to impact the pandemic? Things like gatherings, again, you know, not knowing what was important about these implementations has really hindered what we collect. So, you know, we've got gatherings in the house, personal gatherings outside the house, so things like weddings and funerals. Then you've got events, and then you've got mass gatherings. And we don't really still, I think, understand what it is, which one of these is important. So that makes collecting the data much more difficult. I think if we had understood better what it was about gatherings that was important, every group could have collected far more systematic data. And finally, things which were impacting it, but not anything to do with COVID. So, for instance, every country has school breaks, school holidays. Those are not COVID policies, but actually they are something which is really important and have had a big impact in the way that governments have reduced policies. So in the UK, for instance, you know, our reduction policy was very much based around doing it at a time when schools were breaking up anyway. So, you know, what do you do about it? Do we record that? It's not a COVID policy, but schools aren't there. So how do we handle that type of thing? And I think also just I'll come back to this later, but getting to grips with how we work together and, you know, not working as individuals. You know, I think the taxonomy is probably the biggest example of that. You know, I think everyone was using their own taxonomies and we could have done with just more sort of, okay, these are the ones that we want, and experts saying in economics, these are the measures that we should be recording. Public health people saying these are the policies that are going to be put in place. And if you use these, what you collect about them can be up to you, but these are the categories that you're going to see. And we've noticed that as the pandemic has evolved, that groups have started working together more, and the taxonomies have sort of stabilised out between the different groups. Thank you.
Yeah, thanks a lot, Chris. It really, illustrates how difficult it was to get this common understanding. And I mean, we are still by far not there to have this common understanding. I mean, not only for the collection, but probably also not so much for the measures in itself. And I mean, it would be ideal if the ultimate goal of collecting all this data can be used in a way to get a clearer picture of NPIs for any future preparedness action and future preparedness plans. Maybe now turning to Tommi, did ECDC already have some thoughts on how to use the database for measuring the effectiveness of NPIs?
Well, yeah, like since quite early on, of course, that was one of the reasons as well to start the whole data collection at ECDC, because in fact it was partially started within the modeling team, and then already at that point in the spring 2020, like in the modeling projections that ECDC modeling team was preparing, the effect for certain non-pharmaceutical interventions, such as stay-at-home orders and public gathering cancellations, was first assessed like in the first versions by estimating changes in individual contact rates in the ECDC compartmental model for each country separately. This was, of course, a relatively crude approach, which didn't take into account of simultaneous measures, but only the kind of strongest measure assessed at each time point, nor did it take into account many of the nuances of the implementation of the measures between countries. But even then, early in the spring, summer 2020, we got some insight into how some effect of the measures had on the individual contact rates and then subsequently on the transmission. And we then, especially in the summer, autumn 2020, partially validated these contact rate estimates comparing to, for example, publicly available mobility data. Then later on, ECDC modeling team has also prepared a tool for the selected nominated users from the member states to assist in assessing how to adjust their NPIs in their countries and how those adjustments would affect the effective reproductive number within each country. And then further on, in the schools report in ECDC in the summer 2021, again used the response measure database to assess the effect of the school closures in COVID-19 transmission. And similarly, in the model that has been developed by ECDC in the last months, in the autumn 21, it's also using in the background the estimates derived from the response measure database, using the data from 2020 prior to the introduction of the vaccines, actually. But this being said, overall, most analyses also at ECDC have been quite focused on like relatively short-term effects of these NPIs in each country on transmission, deaths, or, for example, hospitalization rates. Whilst with time, it will be important to focus to assess also on the long-term effects of these measures. And so for this reason, as already mentioned, the ECDC-JRC database is and will remain available for further use and further assessment of the effect or impact of the measures, and also then in a wider perspective, and can be combined with other sources of population movement or contact rate data, as well as different outcome metric data, like population dynamics or different well-being indicators. Thank you.
Maybe now turning to your counterpart, Alessandro, in the JRC. As you mentioned, forecasting and modeling work. I mean, one thing is, of course, to assess the impact of NPIs, maybe also to learn for the future. But of course, to learn also during the response. And I mean, part of some kind of modeling forecasting work is also to see what impact can situations have on health systems. So Alessandro, did you ever use the data to do any impact assessment?
Yes, Thomas. Indeed, we have developed what we call a scenario analysis database. That is a tool in order to forecast the behavior of the pandemic, in particular for long term. And we have included in this tool the possibility to modify and implement measures, closing or unclosing let's say schools or other type of measures. And in order to do that, we have used the database in order to validate and calibrate this model. So indeed, the database was very important also in this respect. And through that, now we have a tool, and that this was available only since beginning of 2021, in order to be able to predict. What we have not yet achieved, and I think this will be future activities, indeed to understand the effect of each individual measure. And as was mentioned already by Tommi, many other teams are trying to get this, but really, let's say the real effect of each individual measure, this is not yet very well known. And there is a project in JRC that intends to use this database through artificial intelligence and try to combine this with epidemiological data in order to have this effect. So the use of the database will be very important, not only in the beginning of the pandemic, but also during the course of the pandemic and during the end of the pandemic, because any type of measure becomes more and more important.
Thanks a lot. Yeah, I mean, indeed. I mean, it's not only the challenge now to really assess the impact, but I think sometimes even it was the challenge to have data, right? I think especially in the beginning of the pandemic, often NPIs just were not monitored. There was just no data collected. So I think that's really something also to see. And the other challenge, definitely, I think for anything more or less in public health, that we always don't work in a bubble, but we have to work with other sectors, with other disciplines. And turning now to WHO, Tanya, how was your experience? How can we foster multidisciplinary collaboration through the use of such databases? Do other disciplines buy in to the use of these databases?
Yes, Thomas, you just said it just now. There was really a need for this type of information, not just for our sector, but also other sectors such as the education sector, transport sector. They were really asking for this information, especially in the beginning where it was not widely available. A lot of questions in relation to what are other countries doing, what are good practices, how are decisions being made, what risk assessments are being carried out in order to come to conclusions on response measures. Of course, while we were developing the databases and the information came available, I think very important was also to raise awareness of this information. So, for example, including these sectors in consultations. So, for example, WHO has run a series of consultations specifically on school measures or specifically on international travel measures. To include stakeholders in there that are also responsible for decision making. So that was one way of doing it. Of course, as part of our work, we do try and analyze this data. So we provide a lot of situation analysis, trend analysis in the regions on specific topics. So publishing these and distributing it to these relevant stakeholders. And then I think, especially when it comes to support in decision making or policy, really to have these people also as part of the conversation when it comes to developing recommendations at national and international level, but also when it comes to looking at the impact of these measures. So overall, I would say, you know, being inclusive when it comes to this conversation on collecting the data and determining recommendations on these measures, including these sectors as well.
Yeah, thanks a lot. Yeah, maybe also asking Chris, because you mentioned also all these different stakeholders you're working with. What was your experience with other disciplines?
Yeah, I found that there's been very good sort of collaboration, and the other disciplines are very willing to get involved. You know, one of the interesting things about this was that, you know, I was very sad when ACAPS stopped collecting, because they had a very, you know, a more of a specialty around the more sort of low income, very high risk groups or at-risk groups around the sort of humanitarian sector. And I found that there is, as the pandemic's gone on, not only has there been the willingness for groups to, you know, to use data that's been collected from the NPIs, but also to look at how we can use each other's data better. So, for instance, you know, working with the people who are looking at enforcement or uptake of measures. You know, there's been some really interesting surveys done around how people feel about these measures. And, you know, we've got what measures are in place, and they've got how the population feel about that. And there's going to be, you know, the research is starting. There's going to be a huge amount of research when you bring these two bits of information together to look at that. And also really interesting things around how perhaps some of the less of the developing world have actually been almost better at putting things in place than some of the, you know, the more developed countries. And there's been some really interesting discussions around, you know, low and middle income countries saying, look, we're good at putting these interventions in place. We know what the issues are. You know, you could listen to us more. So I think it's been really interesting to see, and I think there's been a real willingness for people to use the data sets that have been produced. It only shows, how, within the groups like Oxford, how well respected their stringency indicator, how widely it's used by modelers. Tanya and Tommi's group, supplying the EU countries and supplying information, it's used. They will tell you, they have already told you it is used straight away. There's been a real demand for this data. So I don't think we've had to push at all to get our data sets used. So that's been very promising. And I think that's been one of the really positive things out of all this, how in demand and how willing people have been to use these data sets. Thank you.
Thanks, Chris. That's good to hear. So your labor-intense projects are really being used. I think that's paying off, indeed. But yes, it has a cost. I mean, we heard it. It can have tough consequences from Claudia already. That yes, these projects, they cost. So the question is, of course, also, in case there's still financial means available, you always have to find them. And the question is also, how long is it useful? Is it important? So when is then the time to stop? In a way, we are still in the middle, but one could imagine that maybe some want to see an end next year. We all don't know. But from the pure technical point of view, from the database point of view, when does it make sense to stop? Asking Helen again. Any thoughts?
Thanks. Yeah, I think for us at the moment, we're very mindful that the pandemic is very much a reality in many parts of the world, while it may not feel so much the case here in the UK at the moment. So we're kind of making sure that we do continue to cover everywhere. And knowing when to stop is a really difficult question. For me, I think it kind of splits into two areas, both policy makers and data users and public health. So in terms of policymakers and data users who are using our data, if there's no longer a demand for our data, if there's little policy variation left, so if there's no exciting graphs left to look at and everything's just like a flat line, then nothing interesting left. If there's few policy decisions left to be made, then we're no longer informing those, I suppose. And then from a public health perspective, if the pandemic becomes endemic, vaccines become available worldwide, if there are no new variants, and kind of it does draw to kind of a natural conclusion, and I think those would all be things to factor into the decision to stop collecting information. But yeah, it is a really, really difficult question. Thanks.
It's a difficult question indeed. And I mean, the other perspective could, of course, be, I mean, Chris, you mentioned before that you're already working with other groups, and it would, of course, also be interesting for kind of the, let's say, the second phase of databases to see how can databases be merged. Would that be an idea? Is that feasible? Would it help us in the end to gain more knowledge, understanding of NPIs?
Yes, definitely, especially in a global pandemic. Helen has already mentioned the difficulties in collecting a global data set. And, if you when we compare the different data sets, so initially we took 5 data sets. So the Oxford data set, ACAPS data set, WHO data set, John Hopkins data, and one more, which I'm afraid just slipped my mind, and I do apologise, it will come back to me in a second. And we've got all of this data and we can compare them. So we can compare not just how they collect their data, but what they were recording. And one of the quite scary things, especially at the start, was how little overlap there was between the different data sets. So we were finding 60% of records within a data set was unique, not recorded by anyone else in these global data sets. So I think we have to move to the idea of regional. I think firstly, we have to move to the idea of regional data collection. And then pulling it together and then having the added use of it. So, I would like to see the regions collecting the data set and then Oxford putting it into a stringency indicator, because that would give us the stringency indicator is great, but if the data is limited in various locations, then you've got issues. That does require a bit more sort of acceptance of the fact that there are taxonomies that we can use. What you collect about those is totally up to you, but there are some fairly good taxonomies now. We know what we want to collect. Collaboration also gives you the possibility to bring in different experts, as I mentioned with the ACAPS data. They were really the only group collecting information on displaced populations originally. And in the fields where we still don't have a lot of data in certain locations, ACAPS was the one who was collecting that information. And, not just in that field, but, you could look at finance, you could look at schools, you could look at international travel groups. So there are databases which automatically record what's going on with travel. So we can just use those. And why should each of us collect travel information when there are really good data sets giving us travel information? But I think it totally needs a change of mindset. And this is what we haven't really prepared for. We have to move away from the idea of, perhaps by academics, we're worse at doing this, but this is my data. I'm going to make it open access, but I'm going to collect it for my purpose and then everyone else can use it. And we've got to change to a situation where we say, what data do we need and what's the most efficient way of collecting that? And a lot of that is about saying it doesn't matter. It's not, you're not at fault for saying someone else's data is better than mine. If they specialize in that, of course their data is going to be better than yours. And actually you benefit a huge amount by recognizing that someone else is going to have better data than you, and you don't have to collect it. You can just incorporate their data into yours. And you get better consistency. One of the things that's very strange about, I'm sorry to say, all the data sets, because of the way they're all set up, is comments quite often aren't useful. So you have a text field which should really describe what the intervention is. And a lot of the time it's used just internally. I've coded this as C2. Well, it doesn't mean anything to an external group that are trying to use that data. And I think through collaboration, through sharing data, you actually learn that you can improve your data set a lot. You can be more efficient in the way we collect data. You can save time and money in doing it by saying, I'm going to take your data, you're going to take my data, let's work together. And we found that consistently. It also gives us, going forward research wise, there's going to be huge amounts of research looking at, whether we could automate this better, what people were finding, what the pros and cons of people's different data collection methodologies were. So we've got an extremely rich data set which allows us to say, this is how ACAPS collected the data, this is how Oxford collected the data, this is how WHO Europe collected the data, these are the records they found, this is what they missed, was it systematic, was it random, things like that. So there's going to be a huge amount which we learn from going forward. So hopefully next time we can use this data to say, look, this didn't work here, these were the gaps, and this is what we need to improve that. Thanks.
Thanks a lot, Chris. Sounds like a very good approach for going forward, making this a collective effort. And I mean, NPIs being so complex, I think this would really benefit for being smarter next time. Also discussing about complexity, Alessandro, you're also kind of overseeing many different projects in that area. Any plans to merge different databases for the future, for future research?
Absolutely, this is a very important point. I think that the work that was done by Oxford has been really much appreciated. And we can judge because at the beginning we had our own database of measures, and when we decided to merge with ECDC, the biggest difficulty was not the merge itself, but to agree on a common taxonomy. So to have the common taxonomy, then the data can flow in smoothly. But the problem is, can we agree now, maybe in peacetime, about the common taxonomy for a pandemic? Of course, as it was mentioned before, nobody at the beginning knew exactly what the pandemic would have been. And this is the main difficulty. And so Also, Helen mentioned that you have to have a flexible taxonomy. But on the other hand, let's say if we can learn from the past, from this important pandemic, which are the most important point to follow, it will allow us to save a lot of time, a lot of effort. Because at JRC, we had the unique opportunity to have people of various nationalities. So at the beginning, we tried to split the work into the various, let's say, various nationality and language, so that people could understand well what the individual country could do. But of course, at a certain moment, you come to a point you cannot continue like that. The ideal would be if this type of activity would be conducted by the countries themselves, because they know exactly what they have done. But of course, there must be a common understanding on the type of taxonomy that you, on top of which you want to measure your measures.
Sounds really complex. Well, yes, I mean, this is still a lot of work to be done, I'm sure. And I mean, just also to mention that, I mean, not only kind of fixing things like taxonomy or matching with quantitative analysis, but I think also this qualitative aspect, which has been mentioned, I mean, really also to see effectiveness. And I think in ECDC, we've also been thinking about measuring cost effectiveness of NPIs. I mean, this is also, in the end, we will be needing data from databases, but also insights and findings from other disciplines in a way to really see what are kind of correlations or what impact do NPIs have. Yes. What would we do for the next public health emergency? Having heard all that, all your lessons learned, all your ongoing challenges, how would this look like next time? Maybe, I don't know, I start with Tanya. Any ideas on this?
Thanks, Thomas. Really important question. And I think everyone here in this room has so much experience and learned a lot throughout the last 2 years in terms of not just collecting data or managing a database, but also how this data needs to be used, what outcome it should have, and what actually is useful then for countries when it comes to decision making. I think there's a lot of lessons. We heard about the taxonomy, the data collection process, the need for other disciplines to come on board. For example, when it comes to behavioral insights, so looking at the uptake of these measures, what is the impact also on the population, mental health impact? I mean, this is a big topic, how infodemic and misinformation has played into the whole story of public health and social measures implementation in countries. So it's really a huge area of work. There's a group here that has this knowledge now about the taxonomy, collecting the data, and it will be really important to sit together and to think through these questions and to have things ready, tools that we've developed in this pandemic, taxonomies we've developed, policy guidance, calibration tools, that we put that on the table and see how this can be then used as a basis, whether it's the next pandemic or another public health emergency of international concern. It doesn't need to be a pandemic, but there's a lot that can be used very rapidly then, not having this delay in trying to understand what to collect and what are we actually looking at. So yes, it will be really important to have these consultations and already starting now with all the respective stakeholders. Over from my side.
Thanks. Yeah, you mentioned the uptake. I think that was often one variable missing, right? Countries thought like 1 + 1 is 2, but it seems like this calculation didn't work in all countries the same way. So maybe what worked in New Zealand didn't work in, I don't know, France or somewhere else. But there's probably many factors to it, why this is like this, but it's definitely something also to be analyzed. Anyone else? Any ideas for what to do for any next emergency?
I think it's important that we have more regional data collection, and I think funding is a key part of this. It's quite interesting. Someone did a paper where they looked at funding for this pandemic, and what they found was only 5%, if that, of funding went to collecting or analysis of public health and social measures data set, which, given the importance of these measures, is a ridiculously small amount. And I think we have to have an increase in funding, so that, and then have an idea of, you know, almost spoken hub type data collection, where you have regional data collection and groups willing to work together on shared taxonomies which aren't enforced on them, but they're used because of the fact they make sense and they're developed by the experts. Bringing in different groups so that you have economists supplying their data, and then you have groups like Oxford using this data to produce stringency indicators, and you know, and you have other groups who are very good at building the database, supporting people where they need those data collection work. And I think we've got the knowledge that this is what needs to happen, and I think we just need to make sure that we continue to develop this. We don't get defensive about someone saying, you know, Oxford, you shouldn't collect your own data, that this is viewed as actually a recognition of it's impossible for one group to collect all the world. Funding needs to respect that, and, you know, it shouldn't be Oxford get no data, no funding because they're not collecting their own data. But, you know, we need more funding. We need to be better prepared, and we need to be willing to work together in a way that makes sense for us to have what we all want, which is a good data set, which is then used and allows us to respond to the pandemic. Thank you.
Thanks a lot, Chris. Yeah, definitely. I think the funding seems to be important, especially looking at the stringency of some of these measures. I think countries might want to wish to spend some more money to understand what NPIs can do. Tommi, you also have your hand up.
Yes, so somewhat related to this and what at least Chris mentioned earlier, like having the idea of having like local, national level data collectors. I think it could be one option where it really gives an advantage of capturing more nuance than you can do on high level, like European level or global level. So, and even actually some cases in national level. So that's of course a complex question. And I think it's somewhat related to the fact that it's really important to be able to consider as much as possible and as early as possible which level of detail is needed and in which respect. Like, I think, for example, in COVID-19, possibly collecting a little bit less data on measures, but with better geographical resolution might have actually been a more beneficial in the long run to be able to assess the effects and the impacts. But of course, it was difficult to tell in the beginning. But if this would be done on locally or regionally, the data collection, this might actually allow that kind of practice. So then overall, just as an ECDC, what we discussed with colleagues, like it's important to try to really have these lessons from these data collections and to reach a consensus on how to do it if such a need in the future, like in the respect of taxonomy and the tools and the analysis. Thank you.
Thanks a lot. Yes, I think this really could be very beneficial to have a better regional understanding. Alessandro, any other thoughts from you?
Yeah. No, let's say, I think that in the beginning and also over the course of the pandemic, we had quite some difficulties in getting correct and timely epidemiological data, and to get them in the right format and in the correct format. Slowly then most countries improved, and then now it is much easier to identify those data through web dashboards and other methods. I think that if the same would have been done for the measure database, measure implemented by each country, would have been much easier for everybody. First of all, to have timely information. Second, to have also correct and assessed information. because one of the difficulties that we have in our databases is the curation of the database. So we are indicating some measures, but it would be very useful if countries could validate those information. If those would have been collected directly from the countries, this would have improved these and automatically would have given, let's say, quality to the data that we were collecting.
Thanks. That's also a very important aspect. I think the quality of data and really validation of countries. Thank you so much. I think it was a very rich picture you gave us about the collection of data on NPIs. Thanks for all your time and the questions. And yes, I hope that this will really help us in the future to get a better understanding about NPIs.